Started.
Okay. Are you started?
Yeah.
Alright. Vaccines. Couple questions before we get started. Since the large diseases have disappeared, do you think we still need vaccines?
Yes.
Yes. Vaccines can cause autism and other disorders.
No.
False. Right. And vaccines cannot provide 100% disease protection.
No.
True. Is the way I worded it. I'm here to talk to you about what vaccines are, how they work. Can everybody see this?
Yes. Yes, ma'am.
Who gets them, what the side effects are, why they are important, and how they can save a life, and how they can protect the future generation. Vaccination is when one person takes a vaccine in regards to precaution against contracting a disease. The term vaccine was derived from the Edward Jenner's 1796 cowpox term. He was a pioneer of using cowpox vaccines to prevent smallpox infections in individuals. Now, this is what a vaccine does. It creates an immunity that protects you from an infection without causing the disease itself. Most vaccines contain some part of the germ, but is either weak or dead. The vaccine does not contain the germ that will make you sick. By having a small amount of germ inside your body, it will make your body's defense build antibodies against it to fight off this kind of germ. Antibodies trap and kill germs that could potentially lead to a disease. Antibodies that your body builds stay with you for a very long time, so if you were ever around the real germ, your body would know how to fight it off. Some minor effects ranges from a low-grade fever, which Benadryl can do the trick, to a sore arm, where they stick in the arm or the butt or leg of the vaccine. Some mild side effects, which are most common, are fussiness, tiredness, poor appetite, headache, muscle pain, and itchiness. Some severe side effects, which happen less than 1 out of a million doses, include seizures, deafness, and possible brain damage. The most important factor of vaccines is that they can save lives. On the website www.vaccineinformation.org, it states that vaccinations have saved the lives of more than 3 million people worldwide each year and prevents millions of others from suffering diseases and permanent disabilities. How can the vaccine save your life, you may ask? Vaccines preventable diseases are quite common in other countries and can be easily brought over to the U.S. by travelers. If your child was not vaccinated, they could easily catch one of these diseases from a traveler or by traveling to the country itself. When children are not vaccinated, they can spread these diseases to other children who are too young to receive the vaccine or cannot receive the vaccine due to having certain diseases themselves. And again, some possible diseases that can cause hospitalization, brain damage, meningitis, paralysis, and even death. Certain vaccines can help prevent certain diseases. Today, there are 17 vaccines available to protect children and adults. These, again, can cause paralysis, hearing loss, infertility, and death. Some vaccines out there, the 17 included are the measles, mumps, rubella, pertussis, which includes most children, influenza, which is your flu, shingles, hepatitis A and B, polio, and the pneumococcal, which is more effective in the elderly. If infants and senior citizens should follow the immunization schedule, it can help prevent certain diseases. Yes, senior citizens should get their flu shot and the pneumococcal vaccine on a regular basis. Students entering college should also be up to date. Some FYI, vaccines have reduced and in some cases eliminated many diseases that have killed or disabled many people. If you keep vaccinating your children, and they do so with their children, parents in the future may be able to trust the diseases that, like polio and measles, will not affect them. Smallpox vaccination helped eradicate the disease worldwide. Children do not have to get the smallpox shot anymore because it was eradicated, no longer exists. Therefore, if we continue to keep giving vaccines such as polio, measles, and mumps, hopefully one day the diseases may be eradicated. Now that you know where and when vaccines originated, what their purpose is, here are a few things to remember to help protect you and your family. Myths and rumors are just the same thing in my opinion. A couple myths I want to clarify about vaccines is that would have to be vaccines do not cause autism and or other disorders. They cannot provide 100% disease protection, and it's not best to wait till children are older before starting to give a vaccine. By scheduling immunizations, they are designed to help protect the most vulnerable patients from disease, such as an whose immune system has not fully developed yet, as well as elderly adults whose immune systems are slowly deteriorating. So rumor has it that it can cause autism, and that's false. That it can provide 100% disease protection, which that is false. And it's best to wait to give children older to give the vaccine, and that's false. Certain vaccines are only allowed during a certain time period. If you wait to give that vaccine, you could possibly miss the window when a child is most vulnerable. A statistic from www.parenting.com states that last year in Wisconsin alone, 300 children under the age of 1 developed pertussis, the whooping cough. 177 of them were under the age of 6 months, and of these, half were hospitalized and 3 had died. Vaccines are made with a live weakened virus such as measles, mumps, rubella, chickenpox, and they are 95% effective. If vaccines are inactivated or killed, or with killed germs, they are only between 75 and 80% effective. As I stated earlier, vaccines include the live virus, which will give you a little fever or a rash, but that is less severe than if the child contracted the measles or the mumps. One last myth is autism. 7 years ago in England, this case started up and it was quickly discredited. Autism generally starts to emerge within the first year a child has been born. During the first year, a child has received their fair share of vaccines. Dr. Offit from www.parenting.com states that not only is there no evidence that causes autism, there's no evidence that it doesn't cause autism. In fact, there have been 14 studies that show your risk of getting autism aren't any different than if you didn't give the MMR vaccine. Another doctor by the name Dr. Edwards states, numerous vaccines are given to little babies over that first year just when a lot of developmental changes are occurring. If something happens around that time, it's easy to think that a vaccine caused it. So in conclusion, vaccine can prevent you from contracting a certain disease, save your life, help prevent certain diseases for future generations. They do not provide 100% protection, and you cannot blame autism on a simple vaccine. So from what I just told you, if you are for vaccines, great. I feel as though you're protecting your future generation as well as your own child. And if you don't, that's your opinion. But just remember, if your child becomes ill, do not blame it on not being vaccinated, because you could have prevented it. Questions?
How old should the child be before you get the first vaccine?
2 months.
How many vaccines does the child have to have?
They go at 2 months, 4 months, 6 months, 12 months, 18, 2, 4, and 6. Ooh. And then again when they go to college.
Do pregnant women have to get vaccines for their kids when they're before they're born, or no?
Before the child?
Yeah, before the child is born.
No.
Okay.
They do not recommend that, actually. Cut.
Page 26.